Good morning. Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine, Consultant Neurologist. Today, I'll be giving a brief account on agnosia. What is agnosia? Gnosis means knowledge. Agnosia means lack of knowledge about a perception. So I can simply say that a perception is stripped of its meaning. Patient is having a perception, but the meaning is lost. This can be for objects, persons, sound, shape, smell, etc. Despite intact sensory. So, sensory, visual, auditory, all these pathways are intact. So, hope it is clear. So, this is the lack of knowledge when the perception is there. There are different types. The important things we'll just discuss. So, first is tactile agnosia, or you can call it as stereognosis. Familiar objects are given to the patient. Patient is unable to identify it by palpating. In the presence of primary modalities or sensations are intact. So this occurs in contralateral parietal lesions. So it can be considered as a cortical sensory loss, or is part of the cortical sensory loss. So primary modality should be intact. In the presence of that, patient is unable to identify by palpating. That is the stereognosis or tactile agnosia. Now we think about the visual agnosia. Inability to recognize by seeing an object in the presence of intact sensor system or visual pathways. Patient will be able to describe the object. For example, a pen is shown. He'll say a red colored object, black part is there, so his color is there, able to identify. A cylindrical object, shape is identified, and the length approximately 15 centimeters. But he is unable to say that it is a pen. So that is an example of a visual agnosia. The lesion is situated to damage to the posterior parieto-occipital region. So this is the region, the parieto-occipital region, the contralateral side. Then comes the prosopagnosia. Prosopagnosia means inability to identify the face. This can be a familiar face. Even their own, the patient may not be able to identify. We can detect by showing the picture of common deities or common familiar people or family members. They will not be able to identify. This is called the prosopagnosia. Again, the problem is in the parieto-occipital region. So today we have discussed what is agnosia. So agnosia is a perception stripped of its meaning. It can occur in different modalities, but the sensory pathway should be intact. Hope it was useful. Stay tuned.